As you can then see, is there any just a slight difference between the limbs, or is there a big difference? And what is extremely important is just all the senses of the physician, means the eyes and the hands and everything have to be used to see where is that patient standing. In some cases, when this is not enough, high-tech examination is necessary, and this is especially important in primary cases, just to make sure that there is nothing behind this primary case that could be overseen, if not going into scintigraphy, sonography, MRI, or CT, checking out that there's no other origin behind this. And I want to skip this one because we were lucky to have Mrs. Wittlinger here by ourselves, just introducing to us the history of how we start treating the people, because once the diagnosis is fixed, the treatment of secondary and primary lymphedema is pretty much the same. So this is, again, as you can see, hasn't changed a lot, huh? No, as you can, just the hairstyle is a little bit different, but that was most probably according to the fashion at that time. But anyway, so we can jump into the next. So what we do is using this combined decongested therapy, manual lymph drainage, and I don't want to go too deep into that as well because the specialist is going to do that after me, but just to give you a short summary, it is these stationary cycles, scoop technique, pump technique, rotary technique, that is just combined in a variation of pressure going from a 0 zone to about 40 millimeters quicksilver and then back again, so that a kind of pumping and sucking situation is created by doing so. Then the next step, if this is not enough in the treatment, there should be some additional treatments like the kinesiotape. I just saw over there are lots of books about that, so most of you most probably know about that. Then we have the electrotherapy. This is an oscillating thing that helps to loosen the stick together layers of the tissue by kind of vibrations, which is very important by stages 2 or 3, just to get any kind of flow started. And in addition, we have this, as she said, where's the machine? This is the machine, but it's not comparable to what the hands can do. This is a pump, and in very, very few cases, a surgery might be sensible. But this has really to be gone through with physicians, and when it comes to transplantations of lymph nodes or all these modern stuffs, please, please, please hesitate a while, listen to what others would say, because it's all in a trial stadium at the moment, and I've done a lot of surgery before, and that's why I'm still very, very, very hesitating about topics like that. So the next step would be skincare. Why do we have to do skincare a lot? You can imagine skin being under pressure, like from the edema, is very badly nourished. So it's getting very dry, and it's very, as I said, very likely to get infections on it. So we try to do a very intensive skincare before we start the second important step, which is the bandaging. This is another topic Mrs. Wittlinger is going to go through into details, but just to give you some. Oops, one is missing. Oh no, here we have the pictures. So you can see we have a special system of layer by layer by layer to finally achieve the right pressure adjusted to the patient's situation at that point of his disease. At home, as you can see, it's not going to be easy. So then here comes the point where the tailor-made garments are just the right thing to help you and support you at home, like any kind of tights or socks, or here you can see even a special inlayer to give a certain pressure to the joint area. And this is the part where the patient has to pay his share. So once we've done everything with our hands, with our diagnosis, and with our technical tools, and after we've given some kind of compression to the patient's duty is to be active with it. That means any kind of sports like water gymnastic, Nordic walking, yoga, or whatever could be done is advisable. And the next topic is nutrition. This is always something people like to discuss about because we are in a let's say, in a worldwide diet hysterical situation, there is no specific diet for a lymphedema. But any kind of fat reduction, any kind of salt reduction, and a balanced food uptake is what is advisable. Chatili, after having been in our field and having seen so many successful cases, wanted to prove how this could be seen in figures. So a study was established, and she took 51 patients with secondary lymphedema to more or less under more or less even conditions. They were 3 weeks inpatient stay. They all got their treatment, and just to see the different groups, there were 42 with compressions and 9 without compression therapy due to medical reasons. But what you can see here is that at the day of admission and the day of discharge, in the affected limb in combination with bandage, we had minus 350 milliliters in average, and which is even more interesting, 106 milliliters on the non-treated opposite side. This is a very interesting result, which we've known up front anyway, but here you can see it in figures. And the second interesting part that we could see is that even those who were bandaged had the same thing, like here, seeing the treated leg or arm showing 155 milliliters loss, and even the other side on the non-bandaged group lost 75 milliliters in average. The conclusion of that would be that we can assume or even prove that there has to be a systemic or holistic effect of the medical MLD, and the compression itself is not just the only part that gives us the help, but as you can see, even without compression, the lymph therapy has a very good result. This is the one thing we can see about it, and the second thing that has been tried to proved by other studies is that it is pretty likely that through lymph drainage, the autonomous nervous system like parasympathicus and sympathicus have somehow been activated, or as the other side, the sympathicus, has been put down, decreased by the lymph drainage, which can be seen in the patients after the treatment. They have a kind of chilled and relaxed and easygoing mood, and I would like to have them intensify that in our tasteful ambience and the wonderful mountains in Austria. Thank you for your attention, and I hope to see you soon one day in Austria.
So before I go on with the next topic, which is bandaging, I want just to say 2 words, because maybe some of you have been wondering why I insist so much in saying the original for the method of manual lymph drainage. I do it so many years, and I do still the same thing with my hands. Nothing has been changed. What has changed? That we got much more explanation and much more medical background, what we do, why we do it, and why it works like that, what we see with our patients, and not only edema patients. And this is really one thing which comes from, so to say, the bottom of my heart. There are many more diseases we can treat. Lymphedema brought, when we showed that with manual lymph drainage, we have results that the edema can be reduced. And then at least in Europe, I would say, the social insurance company said, okay, you can reduce this, so we want to pay for that, because it can be measured. But there are so many things you can not measure. And there are also things why I recommend that patients come when they have a heavy edema, when they are desperate, before they completely go wrong, I would say, that they come to a place. I have to do a little bit. I have to speak pro domo a little bit for our house, but I have seen it that it makes such a change when they come into an environment. When they come to the therapist, it's great. The therapies have great results, and I have all the respect